Overview of the project. I'm going to talk a little bit about the background first of how I came to be working on the project, and then I'm going to go into briefly about the Animal Health app development process that I've taken, and then I'm going to present the app, which we've called Health Heroes, and then briefly go through the conclusion. So as we know, according to the World Health Organization, childhood obesity is now a major global public health issue within the 21st century, and just within Warwickshire, 8% of reception-age children and 16% of Year 6 children in Warwickshire are classed as being obese by the National Child Measurement Programme. And up to now, childhood weight management interventions have had limited success, and this is for a number of reasons, such as not including appropriate theoretical content, and actually not targeting the parents in the intervention, and also not directly, and not actually including them in the intervention development process. And this has led to growing consensus among researchers and practitioners alike that really a new and innovative approach is needed, and perhaps looking at the internet and mobile health apps is an option we can look at. Now, as many of us know, health promotion apps have a huge potential from a variety of attributes they have, such as implementation, so low cost, rapid scalability, there's zero geography, and this is especially important for parents. They can be accessed anywhere, anytime. In terms of accessibility, there's widespread adoption across multiple demographics and socioeconomic classes. In terms of the personal nature, phones are always on us, and there's an emotional attachment with our phones, obviously a connectivity. In terms of program flexibility, it allows us to do information tailoring, and also their context-aware capabilities, so the GPS location in phones, and also their sensors. And onto data analysis, it also allows real-time data analysis. So all of these attributes can be maximised if we underpin them with behavioural science and meaningful design. So the aim of the research, I'm just going to talk a little bit about Warwickshire County Council, Warwickshire Public Health. To tackle this problem with childhood obesity, they have two services currently running. We've got the individual services, which is the Change for Life services, where Change for Life advisors work one-to-one with families with overweight children. And then secondly, we've got the family weight management programmes, and there's two currently operating across Warwickshire. One in the Rugby district and borough, and one in Nuneaton and Bedworth. And Nuneaton and Bedworth, I should say, has a higher rate than the national average of childhood obesity. So they also identified the need for a mobile health app, which is where I came in. At the time I was doing voluntary research as part of my training as a health psychologist, and I found out I was doing my research on apps, which actually started with student weight gain, and they asked if I would help them develop a mobile application, so this became the actual focus of my PhD research. And the aim is to develop a theory-driven and user-centred app to support parents in childhood weight management. So really this is a collaboration between the local public health department, Warwick County Council, the University of Warwick, and I also got involved a commercial app company based in London called Virtually Free Limited. And it also involved multiple stakeholders, so input from the parents themselves with overweight children, input from the caseworkers, so Change for Life advisors working with children, and input from multiple experts in dietetics, in psychology, and in public health. And it also drew on two major methodologies using theory and user-centred design, which I'm going to talk about now. So the first method that was used is a behaviour change framework, which has just recently been published, known as the Behaviour Change Wheel Framework. And I don't know if any of you are aware of this. I know you're at the back. And basically, it's a practical and theoretical tool to help people who like to design a health behaviour change intervention. And at the core of the framework is the theoretical tool, the combing model, which I'll talk about in a moment. And this can be further broken down into the theoretical domains framework. And these models help you diagnose what the problem is. And once you have an idea of what are the sort of psychological levers of change that you need to target in your intervention to actually enable you to change the target behaviour, surrounding this, it then links to intervention function. So how can you actually change the behaviour? Is it to do with training? Is it to do with persuasion, environmental restructuring? And this is actually further broken down into behaviour change techniques, which are active ingredients of intervention such as self-monitoring and feedback on behaviour. so forth. So just to give you a quick overview of the theoretical model, the COMBI model, which stands for the Capability, Opportunity and Motivation Behaviour Model. So for any behaviour to occur, a parent must have sufficient capability, so I'm relating it to parents in this case, which involves both psychological capabilities, such as their knowledge, and also physical capabilities, such as their skills to carry out behaviours, such as cooking. It also requires parents to have sufficient motivation, and this can be reflective motivation, such as their conscious decision-making processes, and it can also be an automatic motivation, such as our conscious desire, our unconscious and desires and impulses. And this is really, in most behaviour change models, tend to ignore the automatic processes. So this is why I think this model is a particularly good one. And also parents must have sufficient opportunity. So again, it takes in the obesogenic environment context as well. So it's not only just about the people in the environment, it's also about the resources in their environment. And these three conditions interact to enact the behaviour. The second methodology that was drawn upon was a user-centred design approach. So obviously I'm not from this background, so this is where I had to go and work with some people from the design fields. And user-centred design, I think some of you must be aware of, it really involves iterative development process with your target audience, so in this case with parents. And it really goes beyond just making sure a product is usable, and it's about creating and optimising an experience of using a service or a project. And it also ensures social validity amongst the target audience that are using it, and trustworthiness. So for this project, well, for the PhD project involved two stages of user-centred design. So firstly, formative research involving sort of gathering the requirements, so what do actually parents want in a healthy eating app, and then secondly, testing out those requirements on interactive apps. And this is just an overview of the app development process. I've got more detail on this in a paper, so I'll direct you to that at the end. So as we can see, it starts with formative research, which aims to provide advisors and parents, and also consultation with experts, so dietitians, public health experts. It then moves on to the data, so we then analyse the data using theoretical and user preferences, so using the COBE models and the TDF tools. And we then map these onto intervention functions and behaviour change techniques, and then work with the app company and in terms of how we're going to translate these into app features. And again, consultation with experts helped with this process, and we then developed some interactive mock-ups and tested proposed content and app features with parents. And then again, we've now got a prototype app here, so we've conducted some user testing, and again, this is involved with amending features and refining features. So as you can see, it's an iterative process that is continual, and you also have to cycle back and forth between stages. So the qualitative research aims for this project was, we used the first study to really decide which target behaviour are we going to target in the intervention. Now this might seem like an easy question. Well, it wasn't. So I obviously reviewed the literature, and there wasn't any kind of evidence to say which target behaviour, so was it increasing fruit and vegetables, was it reducing fat, was actually having the biggest impact on children's weight. So I decided to actually find out from parents to see what behaviours are actually more acceptable and practical to them to changing, and what's the most amenable to change within a health app. So once we found out what the target behaviour was, we then developed some questions around the barriers and facilitators to parents carrying out this target behaviour in terms of their capability, opportunity and their motivation to carry out target behaviour. And then what were what parents' preferences for healthy eating app features. So really there was a balance between the user-centred design principles and what the theory said we should be targeting in the intervention, which is what was particularly challenging. And then the second study really was just carrying on the user-centred design process and gathering feedback from parents and experts on the proposed contents. And this really, these aims fed into the overall research questions and what are the theoretical and user-centred app components that are actually necessary to support parents in childhood weight management. So in terms of data and sampling, 45 participants took part in the studies across a series of 9 focus groups, and the majority of the participants were parents of overweight children, recruited from the 2 family weight management programs in Rugby, Nuneaton and Bedworth. In terms of smartphone ownership, 72% of participants reported owning a smartphone, which is in line for this age group of participants. and the majority had the operating system of Android, which again reflects the market leaders. In terms of the parents with overweight children, 46% of their children were overweight, very overweight or obese, 30% were overweight, and 20% were a healthy weight. On helping parents to reduce their portion size, or provide appropriate age-appropriate portion sizes. In terms of theoretical results, I haven't got time to go into them in much detail, but all three of the COM-B domains were found to be important here. So we had to change parents' capability, their motivation, and the opportunity to carry out this target behaviour. And we then linked these to 7 out of the possible 9 intervention functions and further 14 behaviour change techniques. In terms of the user-centred design results, 6 themes emerged around gamification. So parents said we'd like something that had some points, we'd like a challenge that the whole family can compete in. It has to be fast, simple, convenient. We'd like to have some way of monitoring what our children are eating. We prefer to have visuals over text. We're not going to sit there and read things for a long time because it's always... and this relates back to some of the theoretical findings in terms of parents citing that time is a major barrier for them to make changes to their children's diet. So here is just an example of the mapping process for a single app feature, just to show you what was done here in the project. So for example, the theoretical finding of that we need to target parents' psychological capability in terms of their skills to actually measure appropriate portion sizes. This was linked to the intervention function of training, which is further linked to the behaviour change technique of instruction how to perform a behaviour. And this, along with the user-centred design findings of visuals, quick and easy, fed into the final app feature that you can see here, which is the portion measuring guide. So I'm just going to briefly now give you an overview of the prototype app, which we've called Health Heroes. Again, this name is going to be tested out on parents still, so this might still be changing. So we've got a food logging tool where parents have to tag the meal type, so is it lunch, dinner, breakfast, and then how many portions they had and which food group this came from. And this is mainly because parents said they didn't want to sit there going through the brands and things, which is currently in some of the popular health apps such as MyFitnessPal. So we've come up with a portion measuring tool. Why have we used hands? This is because there are no recommendations, which I didn't realise before I started the project. There are no standard recommendations on portion sizes currently in the UK. It differs depending on which public health department you go to. So we decided to use the hands because this is what they're doing in the US, and we've actually seen a reduction in childhood obesity. And this is because it's very quick and easy for parents to pick up on hands, and we've all got them. And what we're trying to get across here is that for measuring your children's portion sizes, for using children's hands, and for using adults' portions, using adult hands, just to make sure that they know there's a difference in what we should provide you. And then we adapted the Eat Well plate, which some of you may be aware of, developed by the Department of Health. So we're still keeping all the different food group colours, except we've split the purple group into 2 colours there. And we also give information on roughly how many portions you should be aiming for within that food group per day. All the information in the app is available to parents on Discovery Learning, so they all get through a quiz. There's no sitting there going through lots of text. So we tried to make it a kind of, this is where the gamification comes in. So they can track their progress and they get feedback on their goals. And again, we brought in elements of gamification here in terms of badges. So we're now in the 3rd stage of user-centred design. So I've conducted some cognitive walkthroughs using the prototype app. I've conducted some focus groups with parents and also some focus groups with the dietitians. And we're also developing an online survey. So just to conclude, there's no such thing as a completed behaviour change app. They need to be constantly updated and refined based on user feedback and behaviour. However, it's really important to, I think, use a systematic development process that actually draws on the relevant theory, evidence, and user-centred principles if we're ever really going to have any chance of improving current development processes and advancing the science behind health apps. And really there needs to be far more partnership between app developers and such as behavioural scientists if we're going to increase the unity in innovation and research. And I'm just going to leave you with a quote, as Sherry and Ranson have eloquently stated: the unanswered question remains not if, but rather how fast and how efficiently mHealth will realise its transformative potential. Thanks for listening.